Hello, welcome. My name's Cece. I am a pelvic health physiotherapist, and today I'm going to be talking to you about how to do a pelvic floor squeeze correctly. So today's topic, we're really going to be diving into what everyone should already know and understand, but actually most people never learnt: your pelvic floor. The mysterious group of muscles down south that keep a whole lot of important things working smoothly. Stay with me, because by the end of this video, you'll know exactly how to squeeze it, relax it, and why that balance really matters. So anatomy. Your pelvic floor is a hammock of muscles at the base of your pelvis. These muscles support your bladder, bowel, and for people with a uterus, women, your reproductive organs too. They help with continence, posture, sexual function, core stability, and yes, breathing, which is why I'm so about it. Basically, they're the VIP muscles that deserve some attention. A functional pelvic floor isn't too tight and it isn't too weak. It actually knows how to do both: contract when it needs to and relax when it needs to. And when these muscles are working well, you may notice things like better core stability, better bladder control, less pelvic or lower back discomfort, improved sexual function, and more ease with movement and daily movement. When they aren't working well, your body often sends little clues. Let's talk symptoms, because dysfunction doesn't always mean weak. Sometimes the muscles are too tight or they're uncoordinated. Common signs include leaking urine when you cough, laugh, sneeze or jump, needing to pee all the time and not being pregnant, difficulty starting your urine stream, constipation or straining, pelvic pain or pressure, pain with sex, or feeling like you can't fully relax down there. If you hear yourself in any of these, you're absolutely not alone, and learning how to control these muscles is a great place to start. Okay, so let's get into the technique, because most people do pelvic floor exercises totally wrong. It's crazy. So let's do this together. Sit or lie down comfortably, relax your belly, your legs and your bum, and imagine you're trying to stop yourself from passing gas, or you're in front of the Queen and you don't want to pass wind. That gentle closing sensation at the back, that's the pelvic floor starting to activate. Now imagine you're trying to stop urine stream. You should feel a lift up and in, not a squeeze of your butt cheeks or inner thighs. Remember to breathe, so maybe try this. Inhale, relax. Exhale, gently lift and contract. Your pelvic floor should respond like an elevator going up. Smooth and subtle, not a clenched fist, and aim for gentle 20 to 30% effort, not 100% like that. So think finesse and not force. So relaxation is just as important, maybe even more important, especially if you tend to feel tension or discomfort in your pelvic floor. Inhale deeply into your belly and sides. Your pelvic floor should naturally soften and widen as your breath drops down. Visualize the muscles melting. Think like a flower blooming, sitting into a hammock, or butter melting on warm toast. Choose whatever imagery feels right for you that helps you remember, and let your hips soften. Unclench your jaw. Everything's connected. If you've never intentionally relaxed these muscles before, you can feel surprisingly good. So a healthy pelvic floor is responsive, not just strong. We want balance. Contract, release, support, relax. That's the order. So practicing a few cycles of inhale, relax, exhale, gently lift can help retrain your system and improve day-to-day function. So this is just a really short video into how to do pelvic floor squeezes and relaxes. But if you need further help, then I suggest you either book an appointment with myself on my website, which is coachedbycc.com, or in your area, trying to find somebody who's another pelvic health specialist who can help you and teach you how to do it correctly. So thank you for watching this really short video. I hope to share more tips and tricks. But in the meantime, if you want to contact me, my DMs are always open, and hope to see you again.